I think that injection they give to you that you can't feel your legs. Hi lovelies, welcome back to my channel. My name is Genevieve. I'm a Nigerian living in Germany. I make videos about life in Germany, travel, personal development. So if that's your kind of thing, please subscribe to my channel. So in this video, I'll be talking about what to do if you're planning to give birth to a child in Germany. So when you come into Germany for the first time, during the first few months, you are expected to register with the health insurance company. Now, the health insurance company will give you a health insurance card. Then, you're also expected as a woman to register with a Frauenarzt. A Frauenarzt is a female doctor who specializes in treating women. That's like a gynecologist. So, if you suspect that you're pregnant, you can go to the very famous druggery store we have here called DM. You get your pregnancy test strip, you do the pregnancy test at home. If it confirms that you're pregnant, the next thing you do is to call the Frauenarzt and then book an appointment with them. Tell them you think you're pregnant, so you want to register and all that. Now, when you go for the appointment, they would ask you for your health insurance card, and then they would also ask you for another urine sample for them to do another urinalysis test to confirm how long the pregnancy is and all of that. After that is done, they would give you a book called a motor pass. Now, the motor pass is a booklet where all your information, your doctor's appointment, every single thing about your pregnancy journey and your medical information will be in that motor pass. And it's expected that you go about with the motor pass, like you carry the motor pass with you everywhere you're going to. In my case, I didn't carry it with me until I think about during the end of my pregnancy. So once that is done, the next step will be getting a hebamme, a midwife. Now, the process of getting a midwife can be very stressful and difficult because hebammes are very, very scarce. In my experience, I couldn't even get one until towards the end of my pregnancy. A very nice lady recommended her hebamme to me. Hebamme is a midwife in English because in Germany, doctors do not deliver the truth. The doctors are not the one who deliver the babies. The midwives are the one who is in charge of delivering the babies. But if there's like an emergency or something, then a doctor will step in. Or if you're having like a cesarean operation, then the doctor will step in. But if it's like a vaginal birth and all of that, the midwives are the one who are responsible for it. Now, sometimes your midwife is allowed to follow you to the delivery room and all of that, but then in most cases the hospitals you choose already have their own midwives, so they will be the one who will do all the job. Your midwife will just be with you throughout your pregnancy journey, like giving you guidelines and some advices and all of that. And then even after having the baby, the midwife would come for occasional visits to check up on you, your health and the baby's health and all of that. Good thing about Germany is that most of their doctors, they speak English language. So even if you're not very fluent in speaking German, English is fine. The doctors, they all speak English. The receptionists you meet might not speak English, but the doctors, they all speak English. So feel free to express yourself at any point. Always make sure you do a lot of research. However you're feeling, just feel free to express yourself. There's an app called Baby Center app. I think every mom to be, every mother should have this app, because this app basically helps you and gives you guidelines about what to expect for each stage of a pregnancy. Even after the baby is born, the app also helps you with daily updates of what to expect for each milestone that your baby would meet. So what to pack when going to the hospital? Now in Germany, you have to be the one to choose the hospital you're most comfortable with. You know, some cities have a lot of hospitals and some cities don't have a lot of hospitals. So you'll be the one to choose if you want to have your child in a hospital, or you want to have your child at home, or you want to have a child in a birthing center. whichever one is fine. The health insurance company covers it all. Now, wherever you're choosing to have your hospital, wherever you're choosing to have your baby, you're the one who is going to figure it all out. Like if you're choosing to go to a hospital to have your child, you're the one who is going to have to do the search, go to different hospitals, make your inquiries, find out which one is your most comfortable with, and then you have your baby there. Now, it's advisable that you choose a hospital that has a pediatrician clinic in it as well. In Germany, it's called a kinder clinic. The reason why it's advisable is because the in case there's anything wrong with the baby or something like that, before you have to start rushing to go to the pediatrician and all of that, the doctor in charge of the kinder clinic, the pediatrician clinic there, would check everything and all of that. In my case, my baby was in a breech position, so when I had my baby, they had to make sure her bones, the hip, and everything was completely intact. And the kinder clinic were the ones who did all that. Her first vaccination was done in the hospital by the kinder at the child's doctor there. So it's advisable that you look for a hospital that has a children, clinic section as well. Now, when you're going to the hospital, you pack very few things for the baby, like maybe two clothes, and then two clothes each, like two onesies, maybe two caps, two socks, and then the clothes the baby will be wearing when you're leaving the hospital. The reason is because the hospital already have clothes there for the children. Honestly, like there are a lot of clothes there for the children. So even the clothes I took to the hospital, I didn't really use it all. I just used very few of them. And then also go with blankets. It's necessary you go with your own personal blankets. Then for the mother, just pack anything you're comfortable with. Pack comfortable clothes, slippers, socks, your phone, your charger, your laptop, books if you want to read. Go with snacks if you want that you can, munch from time to time. Anything that makes you comfortable or that will make your stay in the hospital comfortable, go with it. And also the pad, go with your own pad, but in the hospital they also have pads there for the baby. I don't think there's any need to go with a diaper because the hospital have lots and lots and lots of diapers and wipes there. So to me, it's not necessary. Reduce the load. Then get a car seat ready because on the day you're going home, obviously, baby will be in the car seat and all of that. What else? Okay, go with your documents. Every document like your motor pass, very necessary, your health insurance card, your residence permit card, your any document that you think is necessary. Every hospital has a list of documents you're supposed to bring with you. So go with these documents just in case of anything. Because in my own case, the hospital were the ones who helped us to file for the birth certificate after I had my baby. So I only just like submitted all the photocopies of the documents that I had with me, and then my original marriage certificates. Yeah, they asked for the original marriage certificates, and then they have a criteria, a list. So they were the ones who helped us file for the birth certificate at the rat house. I don't know what they call it in English, like the local office or something like that, in charge of issuing birth certificate and all of that. So some hospitals do help, but then if the hospital doesn't help, you have to do it yourself. So that's about it. What's to pack? That's just anything to make your stay very, very comfortable and very, seamless. For Nigerians, now, we have to go and get the baby's passport because, if you're not yet a German citizen, you have to get the Nigerian passport. So you have to go to the Nigerian embassy and then, get a Nigerian passport for your baby. Now, when you give birth to a child in Germany, the child does not automatically gain the German citizenship. The child only gets the German citizenship based on some criteria, like one, one of the parents of the child must be a German by citizenship. So once you have the baby, automatically the baby becomes a German citizen. But then if none of you are a German citizen, but one of you have lived in Germany for the past 5 years and you own a permanent resident permit, like a permanent residence card. It's called the Nederlandse. It's different from the normal resident permit card we have. If one of the parents has this and you have a baby, yes, the child is entitled to become a German citizen. Now, mind you, this Netherlands allowance, it is not if you're given the Netherlands allowance, as in you find out that you're pregnant during the process of getting the Netherlands allowance. No, it is you must have gotten the Netherlands allowance first before you even became pregnant. Then, once that happens, the child is automatically going to be given the, the German citizenship. Birth certificates that will be issued to you would come in three places. You have one that it will be written Kindergeld on it, one Elterngeld on it, and then the last one will be the main birth certificate itself. The one written Kindergeld on it is what you use when you're applying for the Kindergeld. The one written Elterngeld is what you use in applying for the Elterngeld. The Kindergeld is just allowance that the government uses in supporting families. The Elterngeld is for parents. The government just uses is allowance that given by the government to support parents. And then you have the last birth certificate. You also can apply for an international birth certificate if you want. I really don't know the process to it yet, but I think it's the same way you apply for the normal birth certificate, you also apply for the international birth certificate as well. So how was my experience giving birth in Germany? So I had my last baby about 7 months ago, and it was an elective cesarean operation, and it was just very seamless. Like, the process was so easy. I woke up that morning, took my bath, went to the hospital. The operation started about 30 minutes after I arrived at the hospital, and between 30 to 40 minutes, everything was good. I was given an epidural, so I think that injection they give to you that you can't feel your legs. I was given that, and after the operation, after the surgery, God, I couldn't feel my legs. I was like, oh my God, this is like so scary. But then after they took me back to my room, I think 10-15 minutes later on, I started feeling this tickling sensation on my leg, and then I was able to lift my leg. I was like, Jesus, thank you so much. So my whole experience was good. The doctors were really nice. They were really supportive. They were just there for me. Remember, I said I had my baby was in a breech position. So they were really, really supportive. We tried everything to make her, flip to the other side, but she said no. So they advised that I book for an elective, surgery and all of that. So my experience was really, really good, honestly. It was really, 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 really good. So we've come to the end of today's video. Please do subscribe to my YouTube channel. Till next time. Bye.